So today we are talking about what is abnormal vaginal discharge. So the female birth canal has a way that nature makes it to protect itself, and that is achieved by keeping it a little bit acidic. That acid nature is maintained by the presence of certain bacteria combinations, different types of bacteria in different proportions. So things that will cause an abnormal discharge are things that will disrupt the proportion of the bacteria in the vagina. And what are some of these things? Before then, what is the normal vaginal discharge? Which shouldn't make you worry. If the discharge is normal, it is mostly clear or just a bit cloudy. It does not have any unusual smell. It is not so plenty to make you uncomfortable. And it does not cause any itching or irritation. So these are the features of a normal vaginal discharge. The abnormal vaginal discharge is the discharge which is colored, commonly yellow, creamish, greenish, dark. That is not normal. An abnormal discharge is the one that has an offensive odor or fishy. There is some discharge which has a mild, unpleasant smell, but during sexual intercourse, the smell gets worse. That is certainly not normal. So, the causes of vaginal discharge most commonly are vaginal infections. Sometimes some of the discharge may also be as a result of cervical cancer. And so when you have an abnormal vaginal discharge, you are not just supposed to ignore it or just get any over-the-counter preparation. It is best you are examined. So we figure out what type of discharge it is, and then we deal with it properly for you. The things that can cause abnormal discharge, apart from the infection, could be when somebody takes antibiotic medication for one reason or the other. It disrupts the balance of the bacteria in the vagina. Sometimes, commonly douching, when you douche or you use soap or antiseptic to wash the vagina, you destroy the normal bacteria, and then that can lead to an overgrowth of a different type of bacteria. Sometimes prolonged bleeding. Sometimes the infection is persistent there, so each time you have your period, at the end of the period, you have abnormal vaginal discharge. It means there's an infection which is persistent, and that has to be treated and cleared. A lot of the time, if you leave these vaginal infections untreated, the infection goes up from the vagina, it goes up into the uterus and into the pelvis, and that can result in a pelvic infection, which again, if not detected early and treated, can compromise the woman's reproductive function and lead to tubal factor infertility. And as a matter of fact, majority of women struggling to conceive in our part of the world are as a result of tubal blockage from previous infections, which may just be like a vaginal infection that went up, or infection following unsafe termination of pregnancy. So, if there is any discharge apart from the normal one, it is advisable you seek care promptly so we can detect it, find a cause, deal with it, and also counsel you on how to prevent a recurrence.